Hello friends, welcome to Dezinlife. Friends, Indian pharma industry is not very proactive in taking decision. Rather, I'll say Indian pharma industry is too slow in taking decisions, or you can say taking initiative or doing the innovations. We avoid taking decision as long as we can. It's like, we wait for a disease to blown out, then only we take medicine. Till then, we just go in the name of the God, whatever God do. We'll wait for that. We don't go for the previous diagnosis or early, decisioning and all that. In fact, for that matter, globally also, pharma industry is the slow in the taking the, or can say bringing the changes as compared to other industries. The major reason the pharma industry gave us is that we are not like any other industries. Healthcare is different. And there's something true also. Pharma industry is not something like soap industry. It is different, but unfortunately we are too slow. The reason is correct, but the reason, you can say, magnitude may not be correct. We are too slow the way we show it. Now question is, why I'm talking all those things? My reason of talking now is that now when corona has hit the world as well as pharma industry, then as if Indian pharma industry, we are in process of taking too many decisions. And all the decisions we are taking in the name of corona. Does that mean that as a pharma industry we have become proactive now, or we have become very active in taking decisions? No, we are not doing that. Basically, we are taking most of these backlog decisions, which decisions were due long back. We were avoiding the decisions, or we were not taking decisions. Now we are taking decisions. And unfortunately, in this whole process, we may end up taking some wrong decisions also. But that's how it is. And these different decisions started in the later part of lockdown, that is the last half of the May, and now picking up pace in the month of June. And we can see another couple of months, that is maybe July, August also, we see much more decisions like this. But most of decisions will be in backlog decisions. So today, I'll talk about 8 different such decisions, or 8 different such initiatives which now pharma industry taking more, and most of them were the backlog. So the decision number 1, or point number 1 is the removing of the excess people or unproductive people, and that will up to some extent put a control on the Me Too approach also. Some divisions of the top 50 companies or even some smaller companies have already hit the ground, and the work is going on, as they have somebody has closed the division, somebody is closing the company or field operations also. But those things are happening. It does not mean in any way I'm recommending or I'm advocating you reduce number of people. But I'm saying, when you know that these people were extra, or some people are not productive enough, why we are carrying forward so long? Why we need to take all those decisions now and blaming corona for that? It was something mess up with the business model, or something wrong with the business model, and this is happening now. A second point or second decision is regarding salary corrections. In the last 10 years, friend, in the pharma industry, the salary has increased significantly. It is more so in the senior management. In the senior management, we talk about annual increments, say around 10%. Some cases, I am leaving, he is leaving, or something is happening, or some promotion we take up to the tune of 15-20%. So if 10 to 20% hike will be there at senior level every year, or some cases can be even more also. So salary cost of the senior level has gone up significantly, some extent in middle management also, but certainly not at lower side. So when higher up the salary, none of those salary corrections are being done by means of pay cut. Now, how the pay cut is being done? It's a different company doing different way. Some company, they say across the board, let us cut down the pay by 10%, 20%, or 30%. There are some companies, they are saying, let us deduct this many much, rupees, 1,000 rupees from everyone. But more of the wise companies, what they are doing, they are deducting more money or more percentage for senior people and less percentage for the junior people. Maybe senior people, the deduction goes up somewhere between 30 to 50%, and lower side it has gone down to the 10 to 20%. It's a more wiser way also. In other way around, this salary cut or the salary corrections are also a backlog decision. When you can't pay so much or something, you can't increase 10 to 20% say every year. So that correction or that backlog decisions are being taken now in the name of corona. A third such decision There was no point of keeping such a very heavy top. But most of the companies, they enjoy or they feel happy about keeping heavy top, too many senior people. And this too many senior people, what they do too much of the discussion, and the too much of slowing down the decisioning, and the too less output. So too much discussion and too less output, and at the same time your fixed cost also goes up significantly. Now, courtesy Corona, you are realizing all those things, and such decisions are being taken to cutting down the top, which is again a backlog decision. Long back we should have taken. Fourth point, friends, that is something we talk about expansion, or what is meaning of expansion. When we talk about expansion, we always mean by and large adding number of people, but that is not always expansion. That is one way of expansion. So expansion does not mean adding of the people. Expansion can be by adding the product also. Expansion can be by mean of geography. You cover more geography. Expansion can be by increasing span of control also. Expansion can be by increasing number of the customer also. And expansion can be by adding a different kind of customers also. But unfortunately, in Indian pharma industry, the word expansion is something to do with the adding of the people only, most of the time. And now the too much of expansion, now we are in the reducing mode, courtesy Corona. So again, a wise decision, a correct decision, but a backlog decision, and wrongly put in the head of the Corona. A fifth point, friends, there are too many small companies in India. See, just like a political party in India, which is more of state oriented. But here, it's not only state oriented, it's a district orientation also. Now these small company who are district orientation, some state orientation, they're finding it difficult to move ahead from here because of increased expenditure and because of reduced significant business. So message for these companies very clear. Strategically, let us come together to reduce fixed cost and even some operation cost also. They should have done long back, but it's prolonging. I hope Corona will give them that kind of sanity. Point number 6. Running business always does not mean increasing sale only. Increasing sale is one factor only. But running business means you are increasing business, but at what cost? When you compare a 2-year P&L, you have increased business from X to Y, but at the same time, you compare at what cost. So running business, you need to look at, you are increasing business, you are doing something, but what cost you are doing it. So reducing cost, reducing operational cost is also objective, and increasing per capita productivity is also important. Working with whatever lesser number of people in office also you can do, that we need to look at. So right now, very few companies are working on this model. They are reducing the operational expenses, they're reducing number of people, whether it's a field or whether office. Overall per capita productivity is increasing and their P&L is reflecting better here. So again, some more company will take decision in the name of Corona. Point number 7, friends. Cutting down of Me Too approach and at the same time Me Too expenses also. Say every 3 months, almost every company used to have the meeting. And some company monthly review also. Lot of traveling, lot of expenditure, hotel, now everything is settled down. You see. Almost all the company manager or first line manager has to go to field with every medical rep twice in a month. Why twice in a month? He can't do once in a month what he will do in twice in a month. The expense goes on because something was happening and we have been doing it, which has stopped now. Participating in too many conference by means of taking the stall. There are the conference which has got 100, 200 stalls and companies are participating, even doctors don't know which side which company stalls are. And because X company is participating, Y will also participate. X company has put up the banner, Y company will also put up the banner. So too many conferences and all the pharma industry people are sitting together or taking the tea or taking the snacks, because I am giving tea or you are giving snacks. Let us both come together and take tea with the snacks. And that's how it goes on. And in certain specialty, there are too many societies and too many societies has got national body, zonal body, regional body. So say 2-3 months goes in the conferences only. So this kind of expense cutting down this month is the beginning, and I hope company will take cue from this and we can cut down in the future overall this Me Too approach or Me Too kind of expenses, which nobody knows why we are doing it. And my last point, friend, today is that what decisions are pending is there some decisions, or you can say some businesses or some companies which has got very weak business model, which is not supposed to work, but last couple of years they were pulling on. Again, I'm not taking any company name. They were pulling on. Now with the courtesy corona, they're either stopping the division or stopping the business. It's a bad for the job loss point of view, but some business module which are not likely to work, but they were all try to make out, and they will be full stop on that. So some again backlog or pending decisions are being taken now. And this is a major 8 decisions I have highlighted. Like that, there will be many more. So we are taking too many decisions now because we are putting in the name of corona. It is look at situation like when an earthquake comes, to the tune of Richter scale of maybe 4 or maybe so, which does not so much of damaging, and some buildings start falling down. So actually these buildings are not falling down because of earthquake. Actually the building was supposed to fall. They were just waiting for some reason to fall. And that is why most of such decisions are happening not because of corona, but just they were waiting for some reason to take the decisions or something to push them to taking the decision. So friends, I hope this food of thought will be helping you to analyze the situation, and you will find this video useful. So thank you very much, friends, for watching us today. Thank you.